So, as planned, we're going to start talking about this afternoon dedicated to knowledge development with Serge Morand. Serge Morand, you're ecologist and evolutionary biologist specialized in parasitic ecology at CIRAD, and you're going to present Facing the Epidemic of Epidemics, Tackling the Drivers rather than Managing Consequences. I just remind that it's now possible right now. We can start writing your questions down into the question window on your computer. We have more time than we expected because many of us will not take part this afternoon. So please, for all participants, don't hesitate to ask questions to Serge Morand. Serge, I give you the floor.
Thank you very much. And it's really my pleasure to be with you this evening for me in Thailand. And I will start my presentation, if it's okay now, with my first slides. Try to get it. I'm not sure that I can go to the slide. I click on this. I don't have this. I don't see the slide. Sorry.
We can see them. We can see them.
Oh, I cannot see them. Okay. So sorry. Okay. So you see the first slide, and I will start with the second one, and the second one is about finally before in 2019 I used to start my talk with this kind of news about the new epidemics that can be faced with us. But in 2020, just 2 years ago, actually, not very far, emerged a new coronavirus. And it's just only 2 years ago. And we have to imagine that this was a new fact. And this fact was to be better analyzed in the several facts. And today I would like to present you 7 facts that are important. 7 facts and 2 lessons about epidemics. The first fact is about we are facing an epidemics of epidemics. It's a little slow to get my slide. I'm really sorry. I don't understand. Great acceleration. Okay, this is the great acceleration of epidemics. And the second slide is an increasing number of outbreaks. And when we look at the data coming from the FAO or for the OIE or the WHO, what we recognize during the last decades on increasing number of epidemics, outbreaks globally, for zoonotic disease for humans, for vector-borne disease for humans, but also for the outbreaks concerning the livestock or poultry, or the outbreaks concerning of wildlife disease. Only increasing number of outbreaks, but also increasing the number of outbreaks of new disease that are affecting all the living things. This is the first fact. Our second fact is too difficult. It's not really nice. Sorry, huh? It will take more time. Oh.
We have time, no problem.
Yes. So my second fact, and I would like to acknowledge also that this is also, but I don't know why it doesn't feel. I tried to pass the slides, but I did not see the slide. Try to show you also that this increasing of disease concern also the plants and the wildlife. The second fact, we are living in a globalized planet. So it's not new, actually. It's starting from a long time ago with the global trades, with the first trades, but also with the colonization, but it's increased a lot with the number of increasing of global trades. I have to remember this data that we cannot see for the moment that concern the global trades and travels with the air passengers. In 1970, we were only 400 millions to take the planes. In 2029, we were more than 4 billions of people of taking the planes. 1,300% of increase, which is completely amazing. The third fact is an increasing of the climate change. And now we have the last Lancet report, the countdown, showing that really, as they say, code red for a healthy future. The fact number 3 is about the, does it work? It's
yes, we can see. Okay,
you can see the change. Okay, I didn't see for myself. The number fact for number 4 is the acceleration of farming. And this is also quite amazing data. We have to know that the total number of chicken have increased a lot. We had less than 400 million of chicken in 1960, and now we have more than 30 billion of chicken on Earth. It was the same for the pigs of the increasing. We have to think that now the planet is not dominated by humans, but is dominated by livestock and poultry. The weight, the biomass of cattle is more higher than the biomass of total humans. The number of wild birds that were estimated at 400 billion in 1997, the last count, the last estimation done 3 months ago was 40 billions compared to 30 billions of only chicken. So it means that the total number of poultry, individuals in the poultry, is higher than the total number of wild birds, completely dominated the planet by the livestock and the poultry, which has a consequence, of course, for the impact on increasing of biodiversity loss and also the increasing impact on epidemics. The fact number 6, all of these have a very big importance in terms of great acceleration of changing ecosystems. And I want to show you this fact. When we look at the data from the outbreak of vector-borne and zoonotic disease that are affecting humans on the planet, and concerning the last decades, and we try to look that with the change in the forest cover, deforestation mostly in the intertropical region, but also increasing of crop plantation, and especially also oil palm plantation. This decrease of forest cover or the increase of oil palm plantation are strictly and nicely, unfortunately, correlated globally and timely with the number of zoonoses and vector-borne disease outbreak. Fact number 6 is the rising of the global city. This is another fact that is important. Now, more than half of the people are living in the cities, but this will increase now. We can see with the projection of the United Nations that is not so much in the rural habitat that the population will increase for the next decades to come, but mostly in the urban areas, and mostly in cities in the intertropical region that are really continue to increase. And this is important to see. Why? Because these big cities that will grow up, especially in the intertropical region, is also the region rich in biodiversity at rate, we will see, but rich also in the production of chicken on cattle or pigs or in the livestock on poultry. So we are putting everything really nicely with a changing environment, with higher population density, especially in the urban area, but also with a lot of density of livestock on poultry. So the last fact, but all of this have a consequences in terms of the biodiversity loss, and we are now increasing according to the Living Planet Index, but also to the IUCN Red List, increasing biodiversity loss at a very fast rate. And all of this together, we can draw two lessons. The first lesson that everything is a matter of ecology. Disease ecology and ecology of disease should be understood at the interface between humans, animals, and populations. This is important because now we can reconsider better what happened in terms of hotspot of zoonotic disease emergence that are really in this kind of things that is particularly in certain region, not only the region in the intertropical area, but sometimes in the other region, but also in a good way that it makes much more easy spillover to come from the wildlife to the domestic animal with a huge amplification and after to the humans. And actually, all the animal origin of coronaviruses, of human coronaviruses, and is a big example. So the lesson number two after this is we need really to increase and to accelerate the implementation of the One Health. Thanks to the big initiative, and I think we will have now just after the important representative for the WHO. But thanks to this, now we have new initiatives with by the tripartite plus UNEP, which has the high-level One Health high-level expert panel in these opportunities to develop this, and with a new definition of the One Health. This new definition of the One Health is important for us to better tackle the problem of emerging disease at the interface between the environment, the human, and the animals. And the One Health now is really defined as an integrated, uniting approach that aims to sustainably balance and optimize the common health, the health of people, animals, and ecosystem. Seeing all of this, and to recognize that all of these health, humans, domestic, animals, and plants, and the environment are closely linked and interdependent, but also to ask more intersectoral approach, interdisciplinary approach with the communities at various levels. So it's really to better coordinate society, rural, local, regional, international, with the different collaboration between sectors and disciplines, really to implement and to build the One Health. And for this, of course, we have new initiatives. So I will present very shortly, and I will say that we have these global, we have the One Sustainable Health, for example. We have also the PRESOD initiative that has been launched also quite recently, only 1 year ago, at the One Planet Summit on biodiversity, but we will have more about this, so how to use the One Health approach to better reduce the risk of emerging infectious disease. We have the One Sustainable Health hub that we will have also presented that also aim to better understand and to better manage globally the sustainable health, and especially with one group to better work at adapting finally the relationship between the human and the environment for better human and planetary health. We have also some local initiatives. I don't know if you can see that. We manage that also in Southeast Asia that want to put One Health in practice in Southeast Asia. And thanks to the support of the French Ministry of Foreign Affairs, on really that work on 3 pillars. Knowledge, because we need knowledge and to share knowledge. For this, we can improve skills, but we have to apply, we have to develop the best practices in the One Health approach. And I will finish this with a last lessons for me. It's time to implement new solutions. Time to implement new solutions because we are now we are on the way to better tackle the problems. Global change have a really importance in terms of the local. The emergence is local, and we need to better in this related this global change and the emergence of the pandemic. So we need to understand the relationship between globalization and the local impact in terms of land conversion, biodiversity loss, infrastructure development, the urbanization, and the demands for commodities, for increasing trades, and the mobilities, animals, and plants, and crops, and humans. We need now to better tackle this problem. Tackle the problem and to get the new vision, a new vision that should really link human health, animal health, and ecosystem health. So to better approach the ecosystem sustainability and to find the way for this. And I will finish with this last project that are supported by the one other international organization, UNESCO, the United Nations for Education, Science and Culture, that we should succeed the One Health through resilient territories. We should now work on a especially more, I would say, more optimistic view. We should act really to work on healthy ecosystem that really work for healthy people. What we need in this, we need a lot, finally, to implement this. We need to better have a theory of change. We need to better think of scenario. We need learning system. So how to learn between each different, between stakeholders, not only the scientific, but also the policymaker, the public health, the animal health, and also the communities and the different aspects of the communities. We need also to have a better planning thinking. So these research needs to be really work at the local level, as a community base that could be really also a way to strongly correspond to the better adaptation to other challenges like the biodiversity loss and climate change. And I was very happy finally to hear the mayor of Lyon, because the mayor of Lyon with the Lyon, actually, they are implementing this kind of new resilient territories, healthy ecosystems, Lyon urban ecosystem for healthy people living in Lyon. And I would like to thank you for your time. Thank you
very much. Thank you, Serge. Really, it was very interesting. It was a deep claim to try to find solutions to all these problems that we have to tackle all together. It's a local and global issues. It looks so difficult to imagine to tackle all these problems and to succeed. But of course, all what you say is encouraging. We have to mobilize ourselves. A few questions, because finally the time is perfect. Thank you very much for taking your time. Partisans of industrial farming claim that their focus on biosecurity measures is the way to address reduction of health risks. In China, the African swine fever outbreak, this fever outbreak will result in the disappearance of small farms, and paradoxically, only large industrial pig farms will remain. So it's in a position with what you say. What arguments do you have to counter this position?
Alors, the first argument, we are losing also what we name the cultural biodiversity. All these breeds that have been selected by humans along millennium or centuries and millenniums. All of these breeds, including pigs, most of the pigs have been also domesticated, and we have a very highly diversified pigs there. And we are losing this in favor of the industrial breeds that are mostly completely genetically uniform. So we put them all together, and we think that we can have a farm, we can have some kinds of industrial farms that can be like a high-level biosecurity. We know that even for the humans laboratory, we have problem with leak. We have already problem. So we can imagine. And after that, if something arrived there, we know by the ecology, by the evolution, that is a very nicely way to actually I would say to engineer the new bug that could be go over. And we have to remember that the last pandemic was actually what we used to name the Mexican flu or the swine flu, and the H999, and it emerged from North America for a big farm, and it was not emerging for small farms in China.
So as we talk about the various scales, maybe we can talk about the difference between developed and developing countries. Developing countries are at the same time countries with high biodiversity, high population density, so high risk, as you said in your presentation, on one hand, but less resources to act. So, is the One Health approach going to be implemented differently in developing and developed countries?
Completely, and I did not discuss about this, but I have the chance to read the Global Action Plan for One Health that we will have a presentation later, and I have the chance with the OLEP to have read, and I was very interesting, and I was very happy to read this. Why? Because this plan is completely connected with other plans, especially, for example, the roadmap for neglected tropical disease, and also for biodiversity with the Convention on Biological Diversity. So meaning that, and with, of course, the Sustainable Development Goal for the development goals for the United Nations. So meaning that, of course, there is the way to do this. But the most important things, and because we have also WHO there with the global health, we need to really, we know that we need to have good public health system, reinforce, and especially the community health. But we need the same times a good veterinary public health system, which is also can be also implemented at the local level with the communities. This is the most important. This is the best way actually to prevent.
So thank you very much, Serge. And it's perfect for the transition with Bernadette Abela Ridder from the WHO. So it's very good. So thanks a lot for these precisions and your presentation. And of course, you stay with us because you will be participating to the roundtable in a few minutes. So now it's time to give the floor to Bernadette Abela Ridder. As I said, Bernadette, you are team leader, neglected zoonotic diseases department at WHO, the World Health Organization, and you're going to talk about advancing One Health, creating incentives and removing disincentives. To you now.
Thank you very much. I'll take over the screen. Thanks a lot. We'll have a little bit of switching gears from the talk of Serge Morand, which was very interesting, and I totally agree. We need to look at ecosystems so that we see things together rather than in silos. And I also would like to just switch the gears to a little bit of thinking. I don't have all the answers. I look for this discussion to be a food for thought and for you to also help us provide some of the answers to some of the conundrums we are facing. So don't only give us questions, do come up with some of what you think are potential solutions. So just also working in the WHO, I am a veterinarian by profession, veterinary epidemiologist, worked in food safety, and have always been on the side of looking at things from the public health angle. So I am sort of a rare commodity in the World Health Organization, and I am very proud to be part of this organization, because what we do is take your research from amazing academia organizations and take it into policy and program and scale it up when it works. So we need collaboration. We need to work in a One Health way. And just before I go on, I really would like to sort of congratulate the leadership of the mayor of Lyon, because that is what we need. We need champions in subnational communities and municipalities who actually have the access to One Health because they manage their portfolio across health, across environment, across urbanization. And so they really have the power to change things. As Serge mentioned, and I won't go into this in detail because he showed you the One Health definition, we now have definitions, but we have had the concept of One Health, maybe not labeled that way, but we have already known. Hippocrates spoke about airs, waters, and places. Rudolf Virchow and many others were always trying to think of a more holistic approach to the health of our society, of our environment, of our planet. So One Health is not a new concept, right? We all agree with that. But what can we do to make it work better? What can we do to scale it up? What are incentives that motivate the different sectors and disciplines to work together to come out with a joint, complementary impact? How can we streamline it into all of society approach? How can we as a community do this together? Often we need a crisis like COVID to shake people up, shake things up, or climate change to start to make us think as a community and beyond the individual drivers in effect, and looking across multiple drivers to see how we can address them if there are options for some type of integration or at least coordination. So as I said, there are many partners in this. We have partners at all levels of the globe, at global level, all the way down to communities. And it is a complex system. We realize that. But I think the international organizations, for example, and again, Serge alluded to this, we are working in close collaboration with the World Organization for Animal Health and the Food and Agriculture Organization. And recently it will be more formal, but we have been working with UNEP to make it a complete partnership that covers the One Health, animals, humans, and environmental health. But beyond that, we have multiple organizations working together to try to make a better pathway for addressing risks at this interface. But of course, with the many sectors, it becomes also a challenge sometimes that we not coordinate, and often there's a lot of competition. Who is getting the resources to run this, and why should he get more than us, and who should take the lead on data? How do we link data? Often it takes a lot of work, a lot of negotiation to actually bring in that order in the house to find who's accountable for what, and who takes on the lead in the different aspects, who's the captain on that ship. And so it needs a shift in organizational cultures and addressing of governance as well, on how One Health is taken forward. So this talk is really around what are the incentives and disincentives? What's the carrot? What's the whip? How can we remove the whip and give more carrots so that we make One Health truly start to work? So basically, I will give you some examples on how could we change the paradigm. And as I said, I'm looking not only for questions, I don't have all the answers, but I'm looking for a little bit of thinking of the community with us to see how we can improve what we're doing as we move forward. And as we use this increased interest about One Health, how do we make the best of this interest to have impact on the ground, impact truly on the change in health status of humans, animals, and the environment? Okay, so just again, food for thought. What do we need? What are some of the building blocks? Often we need the political will, right? If we have leaders in our countries, in our societies, who are motivating, who are advocating, who are educating, and who are putting priority and resources into certain areas, then the portfolio will move. If there's no interest, well, it remains neglected. What some countries have done is to try to they have recognized an interest in One Health, and for example, the South America many decades ago realized that for zoonotic diseases, for example, if they didn't have the veterinary public health embedded within their Ministry of Health, there would be some problems in implementation. So they are an example of actually the Ministry of Health taking the lead on veterinary public health as well as public health. Tanzania and Kenya took an option for supra-ministerial type of a coordination where it's not one ministry in charge of One Health, but really it's either a shifting leadership like in Kenya or a supra-ministerial unit that takes care of One Health action. So there are many type of options that countries can choose and try out and see if it works for them. One of the areas I find quite challenging is priority setting. So if I look at the work across the sectors, animal health, human health, environmental, we don't always have the same priorities. Of course, if I look at some of the zoonoses that are endemic, there's not a lot of interest from some of the food or animal health sectors to really take on these diseases as part of their program, because they're not production diseases, because they're not trade diseases, because there might not be any economic gains directly associated. So often there's a lot of conflict in the priority setting. So us as WHO, we might say, we think we should be really getting rid of the ancient disease of rabies, but because it's dogs, the veterinary sector might say, well, we don't have enough workforce to work on the livestock diseases and also the dogs. So again, there's a very simplistic example there, but just to show you that our priority setting is not always the same. And so there's a conflict there on how to move forward. How can we still manage to keep making progress and show through research and other operational research that it makes sense to invest also in other areas that do not seem to have a direct impact for that one sector. But of course, often it's around the resources, right? So if an impact of a management of a health concern, the impact is in public health, well, often the other sectors might not be so motivated to invest resources where they won't see the impact in their sector. Again, on the zoonotic diseases, easy to imagine. Think of epilepsy from Tenia solium caused by neurocysticercosis. In pigs, you hardly see any changes in the livestock. The market value doesn't drop much. So why would you invest in the animal health sector when the outcome would be in the human sector? So again, that's a little bit on the conflict side of how do we resolve these conflicts? What have countries, what have communities done to resolve this? And how do we bring ownership into the most affected groups? So again, I've just brought up the, coordination, collaboration versus competition. We see this a lot, especially once resources come into the equation. How do we, coordinate and collaborate rather than compete for resources? And I think we have a really nice example of Sierra Leone, where the municipality of Freetown, the mayor, has shown leadership in taking on a sort of an integrated program around One Health, looking at non-zoonotic diseases, looking at the malaria, looking at NTDs, but also rabies. So the incentive here would be really looking at responding to population needs. But of course, these are new programs. We have a lot to learn. So often there's some risk attached to it. So how do we remove that risk? How do we improve that baseline understanding so that there is better trust, less risk taking? And again, these are just a few examples, and you will have more. Again, I've already brought up some of the examples. Why would livestock keepers or traders engage in One Health? What is in it for them? What would make them want to engage? If they declare a disease and there's culling without compensation, who would really want to cooperate here? How can we improve those systems in order for livestock keepers and traders to be interested in participating? Why would livestock keepers want to treat animals where they have to pay money, for example, for deworming, when they might not see an improvement immediately in their pigs? How can we look at incentives for livestock keepers and traders to engage? So, for example, if they do see that their pig is growing fatter, looks healthier, gets a better market price, then they would be interested. And we see this, for example, in Madagascar, where farmers are interested in investing a few dollars to increase the market value of their pig once it comes to market. So again, other examples could be, fencing of pigs. Now that we're on the subject of pigs, the disincentives for farmers would be, why would I put a pig into a fence? It gives me more work. I have to clean it. I have to feed it. There are welfare issues that come up. But often there might be a visible impact on the health of the pig, on the market value again. And so how do we increase the incentives to help farmers engage with us? In the end, it is them as well who need to participate in One Health. They are living very closely with their animals and with the environment. I guess another area we need to consider is how do we sort of synchronize with community priorities, and most of the time visible impact is what drives authority communities. For example, I would bring up actually a nice example of with Boehringer Ingelheim, where in Pakistan communities saw that after vaccination or sterilization of the dogs, and they got collars, they both were less prone to biting and more docile. and they were looked at as safe dogs. And so the communities wanted to have their dog with a yellow collar on, because they knew that those dogs were safe. So I think there's a lot that we can do to try to understand from the behavior side, from the social anthropology side, what drives communities, how can we build the education, the level of knowledge, so that those communities can raise a demand for certain services. And how do we look for having sustainable long-term programs, so that it's not project after project that this comes to completion and there is no continuity. So another example I'd like to give here, and this is sometimes an example where there are public good programs, where, for example, vaccination is free of charge. Excellent. In these communities, in many of the underserved communities, the people have a lot of priorities that are competing. You know, do they buy school books or food for the kids, or do they pay for a vaccination of the dog? You know, often it will be the things that are more urgent: food, books, school for kids. So how do we try to build more incentives around public programs, public good programs? And often no charge for vaccination is an incentive, but in some other parts of the world, because there's no charge, there's less value attributed to that service. So again, I just want to point out the value of understanding behavior change, the cultural attitudes, in order to address problems in communities and hear their needs and take in their knowledge and work with them to try to find solutions in their context. Here, and I know today we have a lot of private sector on board. We have a lot of private sector really engaged in participating in, for example, public health programs or veterinary public health programs. And what is it that they need? What are the incentives that would motivate them to engage more with One Health programming? Often it could be market access. It could be social corporate responsibility that is sort of attractive. But there are opportunities here that we might not have investigated well enough. But of course, disincentives could be, you know, conflicts of interest and so such things. Or for the companies that pricing might be affected if the products are used in low income countries. But there's a lot still I think we could do from the private sector front, which could improve the incentives for implementing One Health and veterinary public health. And again, not forgetting that there's a huge workforce out there, the private veterinary sector. How can we engage them more in participating in a One Health approach and helping in that more holistic way? We have examples from South Africa or Pakistan where private sector veterinarians are engaging individually, but how do we scale that up so that we have more engagement also on the public health front? And one of the things we do miss a lot in the One Health world, and we don't know how to do sometimes, is, you know, what is the data we need to collect to fill gaps? And how do we link that data so we make it even more powerful, so that we do not have to wait for a catastrophe like COVID in order to take action, so that we do not have to wait until a person dies of rabies in order to know there's a rabies endemic area. So what is the data we need to collect? We have not a lot of data around that is unified, integrated from the human, animal, and environment. A little bit better in the antimicrobial field, perhaps, but it is something that I think the world now has recognized with COVID, where we need to join the dots to put animal, human, food, environment together so we can be analyzing and predicting in advance. So all integration also has a cost. So what are the incentives for bringing the different actors together to make this piece a more complete piece, and that we work together and join those dots? Okay, sorry, that was the wrong button. And as we come to the end, I would like to, as I said, I work in the Department of Neglected Tropical Diseases. I lead the work on One Health, and I'm embedded in the Veterinary Public Health and Vector Control Department unit in the department. And so one of the pieces we will be releasing on Sunday is a companion document to our roadmap, our NTD roadmap, that looks at One Health as an approach for action against neglected tropical diseases. And so mark your calendars and keep an eye out for this document. I think it's a very, very hands-on type of a piece of reference material that we hope countries and other partners will be able to use in order to take their next steps for action. And to finally end, I would like to announce that we will have a One Health webinar, which we will post on our NTD website, WHO Neglected Tropical Disease website, on the 16th of March, where we will have a webinar to discuss this document, but also experiences from different sectors. And with that, I hope you have enjoyed my talk. I hope you have questions and perhaps also some of the solutions. Thank you.
Oh, thank you very much, Bernadette Abela Ridder. We would love to have a lot of solutions and concrete ones, but we heard you call for action, which is really the core of this day and of the 2 days spent on One Health, and hoping that we will cope with that. But by the way, I don't know if it's a part of the solution, maybe, but there are a few questions for you, very interesting questions. And one of them, that could be helpful, what is always question for Firiel Bekedik, who asks this question, is One Health approach is always advertised and publicized by vets. Why not MDs, medical doctors? Why not environmentalists? It could be a great help to break the barrier. And another question could be, why should physicians engage?
Okay. So, yeah, you're right. The vets are the converted, and we have to convert more. And one of the reasons we did put this document together on One Health to attend to NTDs is in order to bring that larger stakeholders, those larger who might not know exactly how to go about One Health, and it feels a little bit frightening, to bring them more on board to see how they could also contribute. But this is an area where we truly need to build more advocacy, build more knowledge, build more of a workforce that understands how to work together to have a larger impact. But why would the medical field be interested? Of course we should. And I mean, why would the doctors be interested in One Health? I mean, doctors don't only want to treat, you would imagine, they want to also prevent at source. And so a lot of what One Health is doing is really trying to shift the paradigm from treatment to prevention. And that is where they have a stake in their the cure and prevention of their patients, to engage on this, to understand why would you want to put data together from human to human health sector, the veterinary sector, the food sector, the environmental sector, because we are trying to shift to prevention rather than treatment, to prevention and control. Does that answer your question?
Yeah, I think so. I'm sure. Yes, it's pretty interesting. Another question from Xavier Bailey that we're in this morning. To which extent or under which conditions competition among local initiatives could trigger iterative progress in global health management?
Yeah, competition sometimes could be a positive thing, right? You don't need to always dance the waltz together. Competition might actually um, uh, build motivation. And we've seen that in some of the programs actually in Bangladesh, for example, where again, I run the rabies program, so often you'll get a rabies example, but where they trained dog catchers and vaccination teams, and different communities were trained and then they basically had a competition who is going to get out there and get the most dogs vaccinate, have the largest coverage. And so sometimes, yes, competition might actually motivate. Often programs, if a country has, for example, eliminated a disease, well, the country next door feels the pressure and often is mobilized into also taking action. So often competition can be useful, you're right. And I was being rather categorical, right, before, but no, it could be actually quite helpful. But what I was trying to allude to is often when resources come into play, there is a scramble for the resources rather than a a way of trying to say, where is the investment better placed now, and perhaps later there might be a slightly different distribution as we learn how to implement a program, for example. Does that answer the question?
Yes, I think so, yes, really. Guillaume Convert asks, can we consider some environmental concerns as priorities since they create big issues in animal ecology and human health? For example, trash collection to be considered as a major health initiative.
Yeah, huge, actually. And thank you, Guillaume. That's a great question, and I forgot to cover it in my presentation. Trash is a key part, right? I mean, again, I'm going to take a dog example, if you don't mind. You know, without trash collection, we don't have. If there wasn't enough food in the environment, dogs wouldn't be able to propagate as much. There wouldn't be as much survival of puppies. So trash is a big issue. It also is a source of infection. It's for example, in echinococosis, it's the way when offal is just thrown out there, dogs have access to it. You know, there's propagation and of transmission. So yes, trash is a big central block. It's a huge issue, though, right? And often we can't wait until water sanitation is present until we do something to prevent the disease. So then we have vaccinations, we have treatments in order to bridge until the investment in trash and in water sanitation is good enough in order to prevent the problem was occurring. But trash is a huge sanitation, water sanitation, we call it WASH, is one of the big key issues that needs driving. And again, this is an area that is often handled at the municipality level. And so this is where we need to be working closely with municipalities in order to get action on the ground, rather than just sort of overarching policies and legislation, but really implementing the policies and legislation. But often these are very cost intensive interventions and would need longer in order to implement. And so in the meantime, can we bridge until we clean up the trash? Can we bridge to still prevent the decline of health in humans, animals, and the environment? Does that answer, Guillaume, your question?
Yeah, I'm sure he was happy with that. Thanks a lot, really, Bernadette. And we're just going to stay with you because in a few minutes from now there will be the round table, which is dedicated to our knowledge gap to implement a holistic and integrated public health, together with Julie, Teresa Shapiro, and Serge Morand, who stayed with us. So just before I propose a short break during 5 to 6 minutes, and that's 3:30 3:30, we go back to the roundtable. Thank you very much.
Thank you. Thank you for having me.